Hello everyone and welcome back to Clinical Cousins YouTube channel. Today we are going to go over how to determine if your patient has a normal electrical axis of the heart. Now this is an extremely important concept as it is used as a guide to diagnose a vast majority of the pathologies that we will see involving the heart. So it is very important that we know exactly what it is and how to determine what the electrical axis is on our EKG. So, what is the electrical axis of the heart? The electrical axis is the main direction that all of the electrical vectors are pointing. So we must know that these vectors are generated by the ventricular myocytes. In simple terms, the ventricular myocytes or ventricular muscle cells generate electrical activity. This electrical activity moves from cell to cell to cell in a specific direction. This is what we call an electrical vector. Now, I've drawn one electrical vector here, but we must know that there are millions of these little vectors, or electrical directions, as I call them, flying around. And what we do as the clinicians or the nurses, right, is we say that the majority of these millions and millions of vectors are headed in one direction, right? It's kind of like we're taking an average of all the vectors and saying they are pointed this way. This is what an electrical axis is. We are saying that the majority of the heart's electrical activity is pointed this way. So how do we find this using our EKG? Well, basically a fantastic trick that works in seconds is to use leads 1 and AVF to locate the quadrant of electrical activity. So if we draw a big circle around the heart and then we break it up into angles, just like we did for the hexaxial system video, we can divide the heart into one of 4 quadrants. We can divide it at 0 degrees, 90 degrees, 180 degrees, and negative 90 degrees. So, the majority of the heart's electrical activity will point in one of these 4 directions. It is common to label these directions as normal, right, see the big right eye, far right, see the bigger right eye, and then we have left. Now, we must remember that we are looking at the patient. So, our right is their left, and so on and so forth. And we also have to remember that we're talking about the coronal plane. Remember, cutting the body into front and back halves. So we're talking about the X-Y axis. So we're talking about electrical vectors that are moving this way. So I will tell you right now that the normal direction or the normal electrical axis of the heart should be pointed anywhere from negative 30 to 90 degrees. Now, what is a normal electrical axis? Well, the electrical direction that the heart should point towards is between negative 30 and 90 degrees, so anywhere along here. Okay, so once we know these facts, we only have to look at a total of 2 leads on our EKG to give us an idea of where our axis is pointing. Now, instead of doing some long drawn out formula, we are just going to do this very quickly. All we have to do is look at leads 1 and AVF. So we know that lead 1 has a positive end here at 0 degrees. And we know that AVF has a positive end here at 90 degrees. So we know from our hexaxial video that lead 1 is looking at the heart from 0 degrees, right? And AVF is looking up from the feet at 90 degrees. So what I've done is I have drawn 2 circles here. This is 1 and this is AVF. In simple terms, we know that any positive vector headed toward the positive end of a lead will generate a positive deflection. Basically, if our QRS complex, remember, ventricular activation, if our QRS complex in lead 1 is mostly positive, it's more positive than negative, we say that the axis is headed leftward. Is this correct? Because most of the QRS complex in lead 1 is positive, then most of the ventricular electrical activity must be pointing leftward toward the positive end of lead 1. Okay, so now that we know if our lead 1 is mostly positive, it must be headed leftward. We know this. Now, if lead AVF is mostly positive, then we know that the axis must also be headed downward. So let's put this information together. If we know that our axis is heading leftward toward lead 1 and downward toward lead AVF, then we must know that the electrical axis of this heart on this EKG must be headed toward the quadrant that is downwards and leftwards, aka the normal quadrant, right? This is the normal quadrant. If we're heading leftward and we're heading downward, then we must be headed toward the normal quadrant. So in summary, what have we learned? We've learned that the electrical axis represents the main direction of the electrical impulses made by the ventricles in the coronal plane, known as the XY axis. The normal electrical axis of the heart is between -30 and +90 degrees. And if we look at lead 1 and lead AVF, then we can determine if the heart has a normal electrical axis. Specifically, if our QRS complex in lead 1 is positive, and if our QRS in lead AVF is positive, then we know that the axis is headed leftward and downward. Now, as always, thank you for taking the time to learn with us today, and remember to like and subscribe for more content.